It's been a long 2 years since my first video where I was going in the hospital in septic shock. That was actually from my uterus. Right after I had the first tooth removed and IV antibiotics, unknowingly I was bleeding, so my doctor did a biopsy of my uterus and caused a massive infection, which I had been fighting in the last video. Little did I know that was only the beginning of the nightmare. After that, I went into the hospital with a swine flu. Actually, my GI doctor sent me for my abdomen infection, but I had the flu. Then my father died in February, and I stayed there. March, I was still fighting the infection in my uterus from the procedure and recovering from the tooth IV antibiotics and blood clots. I had both arms with blood clots. March 2020, my flipper didn't fit because the woman dentist never gave me the proper one. I bit down and cracked my other front tooth. I went to the endodontist during the pandemic and decided not to do anything. Meanwhile, I'm still battling this uterus infection the whole time. April, May, I get laryngitis and everything, which I think was related to an infection of my uterus being transferred to my mouth. But anyway, I suddenly became in excruciating pain. Ever since that Christmas of going in, before that one video when I was going in the hospital for the septic shock for the bowel, I've been swelling, and I've had a couple blood clots. Well, no one could explain to me what the swelling was. I knew that I had clots in my abdomen and from the procedure from the doctor, but nobody would check. And actually, finally wrote an order to check it way in June of this year, 2020. After all that I'd been through, the swelling, back and forth swelling, you can see I'm extremely swollen right now. I'm actually thinner than I was before because I actually got a new osteomyelitis, and up here eating my jaw away. I'll tell you how that happened. May, I was in the hospital with severe pain in my back and screaming in pain. Turns out that I had a blood clot go to my kidney and they missed it. I didn't know what it was either at the time, but I knew something was desperately wrong in my abdomen ever since the endometrial biopsy. June, I still had the fractured tooth up there on the top, untreated. I get out of the hospital May 31st, June 2nd, 3rd, I go to Dr. Louis Shoha. He's a self-proclaimed holistic dentist that does root canals. I went there. He said, let's do a root canal on the upper tooth to make sure that it's cracked. And I told him that I was having some pain in this jaw here and to check my number 18 tooth back here. So he did a root canal with, I guess, stuff that is unnatural and un-FDA approved for dental work up here. Well, he didn't tell me that. He told me it was biological and safer. So he scraped around this back tooth to check it, and he said, oh, this is going to hurt. So he scraped around it, and I got home, and it was bleeding and everything like that. And so I started treating it with Periodex mouthwash. Both actually, the root canal area and this. 3 days later, I remember I'm still dealing with this falling out infection in my uterus and bowel from my OBGYN giving me the endometrial biopsy. Yeah, and this is on top of the first root canal I had that I had to have IV antibiotics for. Everything falls out. I go to my OBGYN. He thinks he tells the student that maybe it's my bowel prolapsing out of my body. Then I go to a new colorectal surgeon because I was deemed crazy by my other one for having so much problems with my colon and my uterus. Trying to just get somebody to take responsibility for the biopsy gone bad that I've been in the hospital in septic shock for 4 or 5 times. Um, all last year and the beginning of this year, and in 2020, and in August, I get out of the hospital. They don't do anything for me because I had a myasthenia gravis attack, and there were first a surgeon didn't show up at all that admitted me, admitted me in June 5th to the hospital, and for 5 days they had me on IV antibiotics, and he didn't come in. He came in one time and told me that OBGYN wasn't going to participate in my care. This is before these teeth here. Little did I know the teeth were infected from the day prior. So I was in the hospital 5 days without being able to clean my teeth or really much of anything in there because the hospital room had backed up plumbing, backup plumbing inside of it. This is St. John's, Macomb on 12 Mile and Hoover. Horrible, horrible place. Their house doctor comes in and tells me that he's going to check why my OBGYN never showed up during my hospital stay, and he was consulted, and I called and called and called many, many times. So come to find out that the colorectal surgeon, the new one, the brand new one that I never saw, that admitted me, and his partner came in once, discharged me from their care and left me just alone in the hospital with no primary care doctor, admitting doctor. So I went over to the house doctor, which I didn't like this guy already, which I've already known him from a previous encounter in the hospital. So he just decided to mark me as crazy. So the psychiatrist came in and I told him what happened, and I showed him the pictures, and he examined me physically of my bottom half, and he was scared because I had this thing hanging out and bleeding and stuff, and nobody was helping me. And mind you, I have not been able to eat solid food at that point in time, nearly a year since the endometrial biopsy gone wrong. And mind you, I was still trying to fight off that one tooth infection, which seemed like it was going okay. So I get out of the hospital, June. I'm trying to stay out, they told me to go see another specialist, a urogynecologist. So I make an appointment there at Henry Ford. Think I'm making progress, taking me seriously, but I was wrong. Anyway, I'll get to that. I saw a new colorectal surgeon from Henry Ford. He found some stuff out that I didn't know before, and we didn't know that I had other stuff going on with my bowel too, as well. That's happened. So I start noticing on James's birthday, August 8th, that I went to the bird store. I couldn't turn my head. I couldn't move my head around. And then by August the 10th, all my lymph nodes were swollen. My ear was pounding. My arm was hurting. I go to my primary care doctor. He orders an MRI on 8/18, which didn't show anything because I can't have contrast because I have gadolinium poisoning. That's how this all started. I'm a gadolinium toxicity victim. I have nephrogenic systemic fibrosis. So I go in for the MRI. It doesn't really pick up anything. I'm trying to get my oral surgeon to see me. I actually went into this tooth extraction in May before my acute hospital stay. He decided that to hold off this one being pulled because I was on antibiotics, so that never happened. So he rescheduled this procedure here, and I called him and told him I was having issues with 18. After Dr. Shoha scraped around it, looked like it was infected. Missed that appointment because I was in the hospital. Rescheduled it. Anyway, after that, he basically, I couldn't get in to see him ever again. I called him, Dr. John, with the fact that my jaw was swollen. It was an emergency. I needed to get in. Couldn't see me. Nobody would give me an appointment. Nobody would give me an appointment. This is the beginning of August. I went for, no, I take that back. It might have been sooner. I tried about, I want to say 4.5 weeks to see any oral surgeon at all. Nobody would get me in. I actually saw one, Dr. Noor, and he wouldn't take any films. I told him all my symptoms, the swelling, and he could see the swelling in my face, and he was like, I'll see you in a month. September or something, he was gonna extract the teeth, both this one and this one, with no films. And then I said, what do I do about this infection that I'm getting, or what's going on here? And he said, I don't know, just take some clindamycin. So I did that. I went to Dr. Michael Heronshaw, and he did an x-ray here and here and said, I don't know, I can't tell by x-ray. So he tried to refer me to several oral surgeons. I unfortunately saw this doctor before to see if I could get a tooth implant for this upper tooth. Was not impressed by him. Dr. Thomas Bolton of Michigan. I think it's OMS. Called their office. They said they would get me in. I went in. He was really short, really rude. Would not take any x-rays. I begged him for a cone beam. I said, can we see what's going on with my jaws here? Everything just suddenly turned bad quickly from the scraping of my tooth, And he said, no, you'll be fine. He wouldn't even give me any anesthesia. He said that if I had a reaction to the oral numbing agent, that I could just go to the hospital. He didn't care. I almost left. I stood up and started to walk out. The office was filthy. I was terrified. So I'm awake during this whole nightmare. He, first of all, he does this tooth. I felt this tooth here crack. It went crack. I felt it pop and pain shoot up my nose. And he did not even wash this out, and it had a root canal. And he sutured it like a butterfly, even through here. He went and he sutured around this tooth. Then he went down for the lower one, and he cut and dug, and he took a scalpel and he ground everything. He started shaking my jaw back and forth. And I was yelling, and they told me to be quiet, and telling him that it was hurting and that there was an abscess. I thought there was an abscess down in my neck because they had found an abscess spot down in my neck prior to him pulling my tooth. I had showed him this on my phone before the procedure even started. I said, I think I have a peritonsillar abscess of infection somewhere down here. And he's like, I've seen that before. You don't have it. Don't worry about it. So he cuts it all open. I'm awake. He hits the top teeth, and he puts gauze in there, and I guess you're not supposed to seal up an infection. And he sutures it all over, like 13 sutures, all the way into a previous extraction that I had. And then I still have no idea what the heck's going on inside of my neck, because it was pounding in my ear and it was swollen in my neck. But that day, it didn't swell at all. actually. And the next morning I woke up and I had blisters all over the inside of my, like where the skin actually lost its blood supply, and it fell off. The skin fell off, and I went back to him like 3 or 4 times. He would not give me any antibiotics or not even a mouth rinse. And I told him, I'm having this tooth actually went down and shifted, and it was hurting me. And he's like, oh, just give it some time. So anyway, he wouldn't do anything for me. So my neurosurgery ordered an MRI like of my neck, and it showed a fluid filled pocket there behind here. Then he did a cone beam, and the cone beam showed a giant hole on the inside of my jaw on the bone, a round hole. They didn't know if he cracked it or if it was there prior, because nobody would scan it. And the one up here was also like that. And that was his film, Dr. Bolton. So infectious disease ordered a MRI, again a repeat of my face, which on that one they actually burnt me permanently in the machine and scarred my face up. My nose is depressed down, my eyes, it's hard to see without like a shadow. Burnt, distort all the way around my face, especially the top of my nose and eyes, burnt me in the machine. Yeah, really, seriously. And I had, that's been traumatic. But anyway, because I have no blood supply to my nose and skin up here, it's really bad. It's hard to see in this because this video makes you look good. But so anyway, I had an MRI, showed a new onset of osteomyelitis in the bone over here, like away from where he cut on, away from this part, but over here. So I went to U of M. First of all, I called my Dr. John. He was like, you need a CT, but he wouldn't order anything. So he said, why don't you go back to U of M? I said they were a horrible nightmare when I was there before. Dr. Brent Ward, avoid him at all costs. He actually had me referred to a psychiatrist when I had positive cultures and I was on IV antibiotics for my first tooth. I go there begrudgingly, knowing that this is probably a bad idea. He says, come back when it's probably just healing. Come back with it's draining pus, so I have something in the culture. So I come back and I said, it's getting worse. I bring all my films with me, which were ordered by U of M doctors. Doesn't open them, doesn't look at them, nothing. Just says, come back. Remember what I told you. Come back if it's draining pus. So I just start calling random oral surgeons. I saw another guy. He's like, yeah, you have a lot of bone loss here, and I hope you're not losing your feeling in your jaw. This is like 10 days after these extractions. And then I call Cleveland Clinic. Remember, no one will pay attention to me. And at that same point in time, my dentist, who had nothing to do with us, text messaged me because I was going to come in and see him for cleaning and everything, that he doesn't want to be my dentist anymore, that my case is too complex. Well, little did I know that Dr. Bolton and was sending him messages that I'm faking this, So I made the huge mistake of calling Dr. Bolton's office, Thomas Bolton, the one that did the extractions, and telling him that my MRI was positive for osteomyelitis. And what did he think about this? Well, an hour after I told him this, he went into the radiologist room at Royal Oak Beaumont Hospital, told the radiologist that he didn't know when I had these teeth extracted, that it was sometime between 8/18, my first MRI, and 10/24. Yeah, this was on August the 20th. Now we're all the way to August the 20th, September the 20th. We're all the way into like November 1st. He tells the radiologist that he doesn't know when the teeth were extracted. Sometime between 8:18 and 10:24 when he did extractions on 8:20 himself, that it was probably just the new extraction having the holes having liquid in them. Meanwhile, the holes have been closed for a month and a half, okay? And so the radiologist changed my report saying that, well, with this new information from the dentist, it's probably just a fresh extraction site and it's just healing. No, no. So my ID doctor literally thinks I'm crazy now, okay? So he's like, well, you just have osteonecrosis, which is really super bad in itself. So need to see a rheumatologist. I'm like, but osteonecrosis is bone death. Like, that's a huge emergency with or without an infection. Oh, it's not an infection. It's just osteonecrosis, which means bone death, which is very bad. So he's like, see, I don't want to see you anymore. See rheumatology. So here I go back to U of M on ID, because I have nowhere to go. And he also read the report too. So they don't want to see me anymore because, all this is going on. And during this whole time frame, October, the bowel popped out again and fell out. The mass fell out. And so this new gynecology lady wants to see me when this happens. So I go there and they do this invasive examination of me. They had videotaped it. They had students in there videotaping it. I have a copy of the videotape. Well, since I was on so many antibiotics from these teeth, we all thought I had a yeast infection. No, she gave me some kind of like MRSA or something down there, which I've been fighting since then, and nobody can culture it because apparently they only culture for STDs and they don't culture for healthcare related infections that they give patients. They don't culture for like stuff they actually do to patients. Nasty drug resistant bacteria they give patients when they do procedures on them and examinations with filthy, disgusting techniques. And mind you, this is during a pandemic when they're supposed to be washing their hands, and nobody's doing that. Nobody's washing down their hands or anything. So just to let you know, nobody's washing anything down. They're actually getting more sloppier. They're using hand sanitizer for everything, which is why all these infections happen in the first place. The healthcare professionals do not wash their hands. They use hand sanitizer as a substitution for hand washing. But yet they're going to tell us to wash our hands for an extended amount of time to prevent the coronavirus infection. I wish they would take their own advice, because believe me, that's why I'm dying right now. And I'm literally dying. I have been bedridden now, not like the other videos, but I mean seriously bedridden since the last 4 weeks. And yeah, so anyway, it's getting super complicated now because I'm trying to find different doctors to help me. I'm just calling whoever I can. I go to the Cleveland Clinic. They can't open my films. They only can open their films, so they want me to have all my stuff rescanned at their facility. Mind you, I have no veins. I haven't had veins in a long time, since Christmas time last year. So they order a CT scan. So I've called around trying to figure out how to get a CT scan with no IV access. You know, I go to the same vascular surgeon that's been seeing me for over a year and a half, and ask about it again because she had an order. Not that I wanted it, but I couldn't get any testing done because I have no IV access for high pressure CT scan dyes because of the antibiotics and because of the gadolinium fibrosis of my body. Really bad. So anyway, she also jumps on this I'm crazy diagnosis, which actually started at University of Michigan, I think, when I went to the ER there for my blood clot that they missed in my kidney in May, because I was literally discharged from Troy Beaumont, and then my husband took me straight. I asked him to take me straight to U of M, which was a huge mistake because they kept me there. This is in May. And then later on in June, I find out that through a CTA scan, I find out that I actually had a blood clot. But it looks like it killed off my left kidney, and that's why I was in so much pain at that time. Yeah, it's been like a circle of nonstop bullshit um, during this whole, March, April, May, June. I mean, it was prior to that, but it's really, really bad this year. Um, I've had to go to see every doctor you can imagine. I've had racing hearts, sweating profusely. Um, I'm kind of thinking that this sweating and stuff that's going on profusely is coming from my cervical spine, um, and even the swollen lymph nodes here. You know, I've been fighting an infection for a long time. Um, I'll come up with high blood cell counts, and then they'll drop back down, and sweating and fevers and chills and fevers and chills. And I actually had a break of sweating. It was right before this onslaught of debacle of my tooth, my teeth, I should say, plural. Um, it actually had stopped. I think it was related to the Plavix I was taking, the blood thinners. But yeah. So anyway, back to the subject. It's getting so. I'm very confused now. So that's another thing that's wrong with me. It's like up in my brain. Um, and I have the CT scan done. Well, the lady gives me a huge blood clot in my arm, and then suddenly after that, I started to get extremely tachycardic and short of breath. So on top of everything else that's going on, the osteomyelitis of the jaws, and yes, the CT scan did show bone loss down the lower and the top was swollen too, and the bone loss. And I saw a brand new dentist. Finally, I was able to get in. Before the CT scan, I had no dentist because he dropped me, and that's common with dentists and oral surgeons and doctors. If they think your case is difficult or they don't want to treat you because you're, a difficult case, they just discharge you. They can do that, and it's legal. It's the patient abandonment, but they do it constantly. They'll say like, whatever they need to say to abandon you, and they do it constantly. I've been discharged just like I said by my prior dentist, and I hadn't even seen that dental practice before. All I did was post a Yelp review about not being able to see the dentist to get into their office during this whole time, and they dropped me as a patient. So that's how bad it is. Even if they think you wrote a review about them or whatever, they're gonna drop you. So I get the CT. She gives me a huge blood clot. Still, they do the wrong CT scan. Yeah, they actually, Henry Ford, West Springfield, gave me a blood clot, and they did the wrong order. I handed them my order, and they did the wrong CT scan. They did an old one that was in the computer from a year prior. That was written by a different doctor, not the one that the oral surgeon. So Cleveland Clinic still can't get anything, mind you. I've been communicating with them since the beginning of October. Still, as of yesterday, today is December 19th, 2020, have not got my records together at Cleveland Clinic. Yeah, 3 months, can't get my records together for some reason. Called around begging for help, went to the Mayo Clinic. Yep, my new dentist, Dr. Aspie, he's a great guy. He's a smart guy. He's a compassionate man. Finally, I found one at the very end of all this. He makes literally one phone call and sends my records to the Mayo Clinic within 48 hours. I've been told this for 2 years. Oh, I'll send you to the Mayo Clinic. They never send any paperwork. My paramedic, nobody's ever sent anything over. to see if they could help me. Well, now mind you, we're in a massive pandemic. A lot of hospitals are most hospitals are overflowed patients. You can't even get a hospital bed anywhere in the United States right now. Mayo Clinic is no different. So I go there, and it's even more psycho. I saw their oral surgeon, sorta. I waited 4 hours in a crowded lobby because they don't do social distancing there. They'll even check your temperature, okay, before you go in the building. He didn't even really look at anything. Um, he just said, well, the only way to actually know what's going on is to biopsy it. But basically, I don't want to do that. I don't want to biopsy it. Um, didn't want to order any x-rays, films, cone beam scans, CTs, nothing. It was good. So I made an appointment with their nurse practitioner while I was there because I was having, the yellow stuff coming out and bladder infection symptoms super bad going on since the last vaginal exam that nobody would wanted to help me with at all. So matter of fact, I actually saw 2 OBGYNs before this that did the same stupid cultures again, which were negative. Couldn't get ID to even lend me a swab kit for them to check what the bacteria was coming up. Nobody will do that. Nobody communicates and helps with each other. So I had called ID at the Mayo Clinic, and I told them my situation with the discharge and the everything, and asked if they could send them OBGYN over a swab kit. And they were not going to do that either. They were not going to work together. So I get there. Lady does the same stuff I had done. She's a nurse. I tell her that I'm having urinary symptoms really bad, that I'm crying in pain, it's burning, that the infection has moved into my bladder. She's like, okay, I'll order a urine. I was supposed to see ID right after that, so I didn't do the urine there, which I wish I would have, because it's been a week and a half trying to get the results from a separate M lab, Michigan lab. So they're blowing me off. I get my results. It shows E. coli in my urine, and it's resistant to most drugs that they tested. I finally get her those results, and she doesn't care. She's like, drink lots of water. It's probably contamination. Yeah, I'm like, contamination. I came in with symptoms of this going on. Yeah, don't worry about it. Deal with it at home. Now I'm back in Michigan because my husband wanted to leave Minnesota. So I was so sick I could not make it to ID. So I had him call me on the phone. Mind you, I've been there and no one has taken a set of vital signs on me the whole time I've been at the Mayo Clinic, right? Nobody, not even a temperature. So the ID doctor was like, I need to see you. I need to see your jaw. And I mean, maybe it would have been different if I would have went in, but I don't think so, because he kind of had his mind made up on the phone already with me. He's like, your PET scan doesn't show anything. I'm like, well, actually it does. If you look at the scan itself, you can see it for your own 2 eyes. And it actually hit on my uterus too. The radiologist mentioned my uterus lit up on that scan. Where's that at? That doesn't say that. I'm like 4 lines down, read it there. Oh, well, I'm not seeing you for that. I'll let OBGYN take care of that part. Remember, we're only one piece of our body now. We're no longer a human whole being. We're just a part of your body. They don't actually look at the whole patient anymore. I'm a nurse. So he says, I don't think you have an infection because your blood counts are good. I'm like, well, I know I have a uterus infection. I'm dying here for sure. And I've lost so much bone in my jaw. It's actually progressed to the next tooth. It's over here now in these teeth and in these teeth as well. They're red and bleeding and infected. But he's like, well, I don't know about that, but on your blood work, you don't look like you have an infection. On your blood work. Okay. I don't have an infection per my blood work. Great. Tell the rest of my body that. You can see my sweating. I can't roll over on my left side. I went to cardiology. They put a Holter monitor on because of the tachycardia. Of course, I haven't been on a bed, so my heart rate's been slow for 2 days. I went to the hospital, which was a big mistake, at Royal Lake Beaumont on this past Tuesday, December 17th, I believe. And because I had short of breath and tachycardia, really, really fast tachycardia, they put me in a COVID unit. Yes, I'm not kidding you. A non-COVID patient. They assumed I had COVID, and they put me in an actual COVID unit. So I'm in quarantine right now because of this. 6 hours I'm in the COVID unit. I'm like, why am I in a COVID unit? I don't have COVID. I came in for a possible pulmonary embolism in my lung. She's like, well, walk around. So I walked around. My pulse is 114. I took 2 steps. It was 114. Mind you, my pulse is normally 60, even in the 50s sometimes. Well, that's not bad. That's not bad. Fast heart rate. I go, can I be moved out of the COVID unit? And she goes, it's all the same here. Like trying to tell me it's all the same, you know. Mind you, I don't have my protection on. My husband would not bring it into me to the ER. He refused. He refused to bring it in. He's like, well, you finally get to go to the hospital. Now stay there. I don't care if you're around COVID patients, because I begged him before they even put me in the COVID unit, because I could see how it was going, that there it was going to be bad. They had COVID patients waiting with non-COVID patients in the waiting room, and he would not turn around and come back. He was halfway home already, and he would not bring me my protection gear back to me. So if I have COVID, that's why. I visited Royal Oak Beaumont. Nobody would bring me my protection gear, and they put me in a COVID unit. And then the ER doctor, who I saw 2 minutes maybe, that's it, 2 minutes, decides that I don't need a check for a pulmonary embolism or anything like that. I just need the ultrasound team, which was a bunch of students. I guess they are for COVID patients, or not even for regular embolisms, because they ultrasound my lungs, and that's what they do for COVID patients. And they did a chest x-ray, and that's what they do for COVID patients. So I was getting the COVID protocol workup. I wasn't getting an actual pulmonary embolism workup. And I had a bunch of students come in, and they're just like practicing, trying to do an ultrasound on my arms. Oh, you don't see a blood clot. Blah, 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 blah. Well, yeah, it's hard to see a blood clot if you don't know what you're doing. I've had multiple ultrasounds, and believe me, they did not know what they were doing. They were trying to teach each other what to do on my body. Do you mind if we scan all over you? You know, and practice. So that's what happened there. I brought my paperwork in from the doctor's office saying that they found a blood clot. And the ER doctor wouldn't even look at it. So she writes in there,